What is sarcopenia? Sarcopenia is a condition characterized by the loss of muscle mass and strength as a result of aging. It can lead to decreased mobility, increased risk of falls, and a loss of independence in older adults. It is a common condition, and the prevalence of sarcopenia increases with age. There are several factors that contribute to the development of sarcopenia, including hormonal changes, decreased physical activity, and chronic diseases. Treatment options include exercise, protein supplementation, and physical therapy. Who is more at risk to suffer of sarcopenia? Several groups of people are at a higher risk of developing sarcopenia, including older adults. As people age, they naturally lose muscle mass and strength, which increases their risk of sarcopenia. Sedentary individuals, people who have a sedentary lifestyle and do not engage in regular physical activity, are at a higher risk of developing sarcopenia. Individuals with chronic diseases such as diabetes, heart disease, and lung disease can increase the risk of sarcopenia. Other factors that may increase the risk of sarcopenia include poor nutrition. A diet that is low in protein or lacks essential vitamins and minerals can increase the risk of sarcopenia. Hormonal changes. Decline in hormones such as testosterone and growth hormone can also increase the risk of sarcopenia. Medications. Certain medications, such as glucocorticoids, can increase the risk of sarcopenia. Genetics. Studies suggest that some people may have a genetic predisposition to developing sarcopenia. It is important to note that sarcopenia is a complex condition and may be influenced by multiple factors. It is crucial to have a proper diagnosis and treatment plan that takes into account the individual's overall health and lifestyle. At what age your body begins to develop it? Sarcopenia is a condition that typically develops as people age. It begins to occur in the 4th or 5th decade of life, but the rate of muscle mass loss increases as people get older. By the time people reach their 60s or 70s, they may have lost a significant amount of muscle mass and strength. However, sarcopenia can develop earlier in life if there are other risk factors present, such as a sedentary lifestyle, chronic diseases, or poor nutrition. It is also important to note that sarcopenia is not an inevitable part of aging, and can be prevented or delayed by engaging in regular physical activity, maintaining a healthy diet, and managing chronic diseases. What is the danger of sarcopenia? Sarcopenia can lead to a number of negative health outcomes and complications. Some of the most important include decreased mobility. Sarcopenia can make it difficult for older adults to perform daily activities, such as getting out of bed, climbing stairs, or going for a walk. Increased risk of falls. As muscle mass and strength decrease, older adults may be at a higher risk of falling. Loss of independence. The decreased mobility and increased risk of falls associated with sarcopenia can lead to a loss of independence in older adults. Increased risk of other health problems. Sarcopenia can increase the risk of other health problems, such as heart disease, diabetes, and respiratory problems. Increased risk of death. Studies have shown that older adults with sarcopenia are at a higher risk of dying prematurely. Sarcopenia can also have psychological consequences, such as depression and a lower quality of life. It is important to note that sarcopenia is a complex condition and may be influenced by multiple factors. It is crucial to have a proper diagnosis and treatment plan that takes into account the individual's overall health and lifestyle. Is there some form of exercises a person can perform to prevent or control it? Yes, regular physical